and welcome. You're watching the Health Talk session by Yashoda Hospitals. More than 14 million children are obese in India, ranked second highest globally. So what are the causes of childhood obesity and what impact can that have on one's health? So let's discuss about childhood obesity in our today's episode. I'm Dr. Lakshmi, and joining us, we have with us Dr. Srinivas Midivelly, consultant pediatrician from Yashoda Hospitals, Malakpet. Welcome, doctor.
Hello, hi. I'm Dr. Srinivas Midivelly, a consultant pediatrician from Yashoda Hospitals, Malakpet.
So doctor, according to the latest statistics, it shows that the global prevalence of childhood obesity has tripled over the last 5 years. Why do you think it is so prevalent, especially in our country?
So, first of all, we would like to know about obesity. So, obesity is a condition called as accumulation of lot of fat in the body. So, we can find obesity based on the plotting of the weight and height of the child on the growth charts. And noting on the growth charts, we can find whether the child is landing into the obesity or overweight. So the main reason why we are seeing the increase in obesity is the imbalance between the calorie consumed and the calorie expenditure. So that's because of lack of physical activity. So we post-COVID era, we see a lot of children using mobile phones and spending a lot of time on the screens. That is causing a lot of decreased physical activity, and this leading to more obesity in recent times.
So what are the causes leading to childhood obesity, doctor? Do genetics play an important role in this?
The main causes for the obesity are, first thing is like primary environmental causes, and the second is secondary genetical causes. So the environmental causes are mainly because of, as I said, lack of physical activity and consumption of energy rich foods. So if there is a balance between the calorie consumption and calorie expenditure, so there can be a chances of increasing the weight. The genetic conditions are more when you see like condition like a thyroid problem or endocrine problems, all this can lead to obesity in children.
But doctor, especially in our country, if the child is chubbier or on a healthier side, we as parents, we tend to like it and we be happy for that. But do you think it's a good sign? Otherwise, when do you think that parents should be worried that the child could be obese?
As a developing country, I know that most of the parents want their child to be looking chubby. But the real healthy thing is not the chubby. We should know about the child activity, how the child eating well, how he is doing at the school performance. All this comes under like a healthy child, not just looking at chubby. So how to plot or how to find the red flag signs if your child is going towards obesity? The first thing you have to see whether the child is growing appropriate, I mean that height. So if the child is growing only on weight and it's not growing in the height, that is definitely to be addressed point. And the second is any emotional disturbances, like he's getting bullying at the school or he's getting bad performance at the schools, we have to think. And is your child is having any learning disability? If any of these signs are there, please, it's a red flag signs, and take care near to the pediatrician to look whether the child is suffering with any primary causes, like I said, because of the lifestyle things, or the secondary causes like thyroid or any endocrine problems.
So now we know that the childhood obesity is the unspoken pandemic. So what are the general ill effects that obesity can have on one's health?
So we see a lot of problems with the obesity even in the children. So primarily it may cause the illness, the the susceptibility for the infections will be more in the children with obesity, and the recovery rate will be also slow with obesity in children. So the other things we see is like, as I said, there will be a lot of emotional disturbances like bad school performance and emotional liability. These are the general things you see with obesity. There are other medical conditions to be addressed in case of childhood obesity, like medical condition like increase in blood pressure, increase in cholesterol levels, and cardiac diseases like hypertension, and next will be the respiratory problems like having recurrent respiratory infections and asthma. These are the most commonly affected problems in children who is having a childhood obesity.
I think the first step to tackle childhood obesity is that the parents should identify that the child could be obese. So how do you think the parents can do this?
There are few things where we can identify whether your child is having obesity or not. The first thing is whether your child is growing appropriately for his height. That means like if your child is growing only on weight, not by height, that's the one sign or symptom we have to address it. And the second is having any dark discoloration of skin over the neck. The third is snoring, which you usually see in the children with overweight. And fourth is like delayed puberty. If the child is not growing appropriate for the age, that should be addressed. These are the few signs or symptoms where you have to address to the pediatrician as early as possible.
So doctor, what is the next step that the parents should take if they think that the child could be obese?
As we already discussed that no parents want to address or mention their child as an obese child. So the best way they can do is reaching a nearby pediatrician and plotting the weight and height for the regularly for the next 6 months to 1 year and see whether the child is growing in appropriately for that age group. And the second thing they can do is pubertal assessment if the child is growing normally for that age. And the third is going for the blood test, like a simple blood test like a thyroid function test or the endocrine problems causing a diabetic test, or most of the times these will tell whether the child is having any abnormality in the lipid profile, that is called cholesterol test. This will give a clue whether the child is suffering with the disease of obesity or not.
So doctor, what are the measures that parents can take to prevent childhood obesity?
The best way to prevent obesity, as we discussed, the obesity starts from the womb. I can say that the pregnant females or pregnant women has to take the appropriate nutrition and should gain an appropriate weight during the pregnancy. That even affect the obesity in childhood and adulthood. So as I say that obesity, the problem starts from the before the birth. So it's better to start taking care of the good appropriate nutrition during the pregnancy will definitely help in preventing the obesity. And the second thing is more of dietary lifestyle. As we call this disease itself, we call it a lifestyle disease. Previously we used to see a lot in the adulthood, but now because of increased calorie dense foods like high sugary foods, junk foods and taking lot of high calorie dense foods frequently and frequent increase in meals, all these are causing lot of high energy consumption foods. So the second is lack of physical activity, which we are seeing after the post COVID era. So the best way to prevent all these things is teaching your child what is good food and bad food. So teaching them early from the age of 1 year, 2 years will help to know them what is good food and bad food. And next is decreasing the screen time. This is the most important what we see after COVID, because most of the time during the COVID the children is at home and they were using phones for more than 1 hour, 2 hours, 3 hours. So the best ideal screen time recommended by many societies is less than 1 hour. So increasing the physical activity for more than 1 hour 5 days a week it's advisable, and decreasing the screen time for less than 1 hour is mandatory to prevent obesity in childhood.
So before ending this episode, doctor, is there any message you would like to give to the parents out there as far as childhood obesity is concerned?
So as we discussed, the best strategy is like health and eating habit should run in the family. I say like you cannot ask your child to eat a good food ordering a pizza from a Swiggy or Zomato. It's the best way it is. Obesity runs in the family, and you should address from every family member should take care of food habits and exercise habits. That will help to prevent childhood.
So thank you, doctor. It was wonderful having you here on the program today.
Thank you.
So this brings us to the end of this episode. Hope this episode was informative as far as childhood obesity was concerned, and don't forget to join us for the next week as well. Till then, take care. Thank you.